Let's talk about passing blood clots while you're on your period. Hi, I'm Dr. Toya, board certified OBGYN, and if you have heavy bleeding, and sometimes if you don't have heavy bleeding during your period, you may see blood clots, and I wanted to talk about why. Anytime you have blood that clots is actually a normal thing. That means the systems in your blood are working normally, and it just means that the blood is sitting somewhere and pooling and forming a clot. Blood that is in flow stays liquid, and you don't have that clotting happen. So there are two main reasons why this will happen with your period. The main most common one is that the blood pools in the top of the vagina when you're laying down or anything like that, and it just stays there and forms a clot. And when you stand up, you pass it because of gravity. That's usually not very painful. If it's very, very big, it can cause some discomfort coming out of the entrance of the vagina, but usually not cramping or anything like that. Now, if you have a condition where you have very heavy bleeding during your period, that can be very painful. And just going back to what the period is, that lining of your uterus that is shed every month is tissue and blood that comes into the canal of the uterus and passes out through the cervix. Usually it happens at a slow enough rate where it continues to be liquid and passes out through the cervix. If it's so heavy that it doesn't have time to pass through the cervix, it will pool in the uterus and form a clot. Then that clot has to now get out, and that's what makes it very painful, because anytime something comes out through the cervix, especially if it's not open, it's like you're having a baby. So it can cause cramping, a lot of pain, and that's where people who have fibroids get those complaints. So of course, in the second instance, it may be that there's something abnormal that needs to be addressed. So if that happens to you, please talk to your doctor about what can be causing it and what your treatment options are. But if it's just that, you're laying down and then you stand up and pass some clots, may not necessarily be abnormal. So let me know if you have any questions, and if you like the content on this page, sign up for my newsletter. Link is in my bio, and I will send more information right to your inbox.